to help people be empowered.
Guys are so special, and you got to do your studies. So the first person I'm going to bring out to this roundtable is someone that I don't think she's thought about this. But after speaking with Jezy, I really think that this could change the world. And that is Dr. Volner. Because I believe that Dr. Volner has two things that I think can really change the game. And that's pairing chiropractic care with naturopathic medicine and creating a study based on that. The next person I want to bring out is another genius. And it's unfortunate, like Jezy said, that she doesn't get the shine that she deserves. Because honestly, nutritionists should be viewed as MDs. Because there's a lot of value that she brings. And when Dr. Nadia Taylor comes on, I really want those two to create a cancer study together, because I think that what Lori brings to the table and what Dr. Nadia Taylor brings to the table is special. So Lori, if you want to come on up. To it is Dr. Nadia Taylor. She's an alternative cancer doctor and a functional medicine doctor. And I think that the value that she brings to medicine and creating a study, I think could be a game changer. The next person I want to bring to the stage, Lynn McIntosh as well. Lynn focuses on narcissism, and she's a hypnotist. The next person I want to bring to the stage, life architect Jim Paconin. My first question is going to be for Dr. Taylor because she hasn't spoken yet. It's, what does vitality mean to you, and how can functional medicine help with vitality and experiencing it?
So that's a great question. So vitality to me is living at your optimal level, your optimal energy level, brain function, all your organs functioning optimally, and really experiencing life at its fullest in every capacity: mental, physical, spiritual, emotional, all of that. So I think functional medicine is great because it really looks at the patients in a holistic way. So we're not just looking at physical systems, we're also looking at mental health, looking at environment, and really putting an emphasis on lifestyle. In the past, in traditional medicine, that was kind of one of the things that we did as an afterthought. Yeah. But with functional medicine, that's at the forefront. So we're looking at lifestyle, we're looking at what are you eating, how are you sleeping, what are your support factors? Do you have good emotional support? Do you have a means to handle stress well? If not, can we help you with that? So we're really just looking at the whole patient, not just lab values, not just doing a physical and sending them out the door, but looking at the whole person.
How can you work well with a functional doctor?
It's so much easier working with a functional medicine doctor because they understand the basic principles, like you just said. And, I went to my physical yesterday with my medical doctor, and the first time I met her, she told me, we can't run those blood tests. And I said, yes, you can. So, I jokingly say, I think I'm going to go into patient advocacy so that there's a bridge between patients and the medical system, so we can use the medical system for the blood tests, but then have somebody who looks at your blood test from a very different perspective. That's just my... Yeah. But she gave me a hug at the end of the visit, so I've been working on her for 4 years.
Yeah, I think in the past, there's a lot of paternalism in traditional medicine. It's like, we know what is your problem, we know what, needs to be fixed. Whereas I think functional medicine differs in that it puts the patient in the driver's seat, and we're not just telling them what to do. So I think that's
and we're really listening. We're really listening, and I think that's a big difference. When you go to a traditional medicine doctor for your annual, it's all about getting the notes in the documentation platform. It's all about compliance, and honestly, like, I understand that. I've been there. I did home care for many years. I understand that. But then there's the warm touch. Then there's the questions. But medicine, like, we as the consumers, we need to take responsibility for our health. And then, God forbid, you have an accident, you break a leg, you have whatever. But chronic disease is 80 to 90% preventable through diet and lifestyle.
Yeah.
And so if we take care of that, then we can really use doctors where they shine. You know? Stop
100%.
expecting doctors to do root cause. They're not. That's not the way the system is constructed. And it's unfortunate, but that's the way it is. And emergency room doctors are amazing.
Stacey Theodosian in here, who works in a cancer clinic. She applies Eastern principles. She's an Ayurvedic physician. So, Stacey, my question for you is, in seeing your patients while you're working in the clinic, how do you notice that applying your Ayurvedic principles help with your patients?
On so many levels. Expectation for Western medicine doctors, they don't know a lot about nutrition and how that impacts people. They don't really understand a lot of the lifestyle practices that are part of Ayurveda, like, for instance, meditation and how that can impact people. Movement, movement activities like yoga and stuff that promote mindfulness, not just physical exercise. So I think people learn a whole bunch of things. And again, I'm dealing with a population on a daily basis that already have cancer, right?
Mm-hmm.
And a lot of times they're trying to clean up their eating, they're trying to get more movement, they're trying to add in these different things, and they don't even realize how far they stray with the chemicals in their personal care products, for example, or the chemicals in the cleaning products, or that when a label on a product says fragrance, that's a minimum of 150 volatile chemical compounds, right? Minimum. So they don't realize how they're being impacted on a daily basis and how important their own voice is in choosing how they're going to care for themselves. So I think people learn a lot, of course, about nutrition, about meditation, mindfulness, how to incorporate plant medicine into their daily lives. And they really clean up a lot of things and learn a lot of things, because I've been working with the Cancer Treatment Center for 28 years now. And it seems like the patients are getting younger and younger, so I see a lot of people in their 20s that have stomach cancers, colorectal cancers, and things like that, which, I'm going to say probably have a lot to do with the foods that they're eating. And I also see a lot of skin cancer. So we hear about certain cancers a lot, but skin cancer is actually one of the main cancer diagnoses regularly. So, I'm seeing young people with melanoma, people in their 20s and 30s with melanoma, and so on. So, obviously, their habits and lifestyle are very much impacting their well-being and their longevity, So, and really, it's an awareness thing. And that's why I'm so happy to be here today, because a lot of people don't know what else is available. And if you grew up in a Western society, then, and my story, you go to a Western doctor because that's what and they don't always have the answers. And to go back to Lori, because she was speaking when I came in, they don't understand the root causes. They just want to treat the symptoms all the time. And so there's absolutely times that we need medication or a surgery of some sort or whatever. And I'm so grateful and thankful that there are doctors there, but we need to work on the preventative side for sure. And then the corrective side, when people already have a scary diagnosis, that there is life beyond cancer. Lots of people survive and thrive, and our theme today is vitality, right? They can find vitality. And a lot of the people I've met over the years tell me, 20 years ago, I thought I was going to die, right? And the best thing about getting cancer was meeting you, because now I actually take care of myself and I feel more balanced, and I feel better on so many levels, and so people really can heal and come back from those kind of things. Really, I like to be able to bring awareness. And as you know, today I was actually working with the staff at the hospital, because one of the things we're trying to do, stress is a huge contributor to all of these, states of unwellness. And so nurses and doctors have a very high suicide rate. And so we have a grant that is focusing on um, reducing stress amongst the staff members. So on a weekly basis, I go into different departments in the hospital and work with the staff members. And again, then they're learning a whole bunch of things too that they didn't know existed. Like one lady, I was showing her how to do open her vagus nerve, right? Like a nurse, because she has chronic migraines and headaches, and which of course the vagus nerve starts here in her neck and it comes down in digestive issues. So I had her do a simple 2-minute exercise today while she was with me. And she was like, my headache is gone. I feel completely changed. And I'm like, just remember to take that 2 minutes and do and I had her do a breath work thing, make a vibration. Because when we make the vibration in the body, that helps us heal too. So there's so many subtle ways that people can learn, very easy things that they can do while they're at work, and literally take 2 minutes and do some Nadi Shodhana, which is alternate nostril breathing, or do create a vibration. I like to do VU. So you breathe in and then say VU, and it opens the vagus nerve, right? So then that starts, that's the largest nerve with the branches all over the body and into the digestive tract. So people can literally in 2 minutes change how they feel. And that's an eye opener for people, that they can get rid of their chronic stress, even working in a stressful hospital environment, and then their lives are improved. And literally, I know you like numbers, 100% of the staff I've worked with, 100% have reported improved emotional well-being and reduced stress. The work that we do, 100% of the people. I'm really happy about that. No complainers.
That's fantastic. So my question is for Dr. Volner and for Dr. Taylor. My question for you, Dr. Volner, just for you to jump in, is you spoke today about gut health, and how does the work that you do in naturopathy play a role in addressing gut health?
So gut health, the gut is actually run by the vagus nerve. So that's why if you had an injury where your spine is damaged and you're paraplegic, your intestines, your kidneys, all of that still work because of how the vagus nerve travels. And so 80% of that function in the intestines can be actually created more happiness in your intestines by vagal nerve stimulation. But what I do also in chiropractic adjustments is manage the stress in the spine that also goes to the intestines, because even one of my clients, before we could order supplements to handle her digestive issues, was getting better just by alleviating the amount of tension that was on the spine between the shoulder blades, which is where most people carry their stress. Getting an adjustment there to release the tension, reduce the amount of pressure and on the nerve, and thus the intestines work more normal. Naturopathically, making sure the probiotics are balanced properly. Easy to do a stool test for those who have chronic bloating, gas, constipation, IBS symptoms. We can do a stool test to see if the probiotics are off, if there's any pathogens there. We can treat to kill pathogens with herbal supplements, as well as probiotics to replenish properly. And sometimes it's a digestive issue where they just can't break down their food enough. So enzymes when you eat, or just altering what you eat with your food. My sister did well having a dill pickle before every meal, having that vinegar, a little acid added to her mix, and a little bit of the fermentation also of pickles. And you can use sauerkraut. Every nation, every people group has a fermented food that helps to replenish that gut as well. But when you need a therapeutic dose, just 1 cup of yogurt's not enough. It takes 20 cups of active yogurt in order to be 1 therapeutic dose of a probiotic. So it's good to take that in a quality pill form when you're in need of replenishment.
Yeah, so a caveat, this holistic center that I've just set up, we're just getting started with all of the holistic modalities that we're bringing to help patients with chronic disease like cancer. So we have a hyperbaric oxygen chamber, we have red light therapy, and we have IV vitamin therapy. We also have a holistic nutritionist on staff that is here to help clients, get their diet together. But certainly, definitely seeing younger patients with cancer. Not only are they presenting with cancer at an earlier age, but the cancers are more of an advanced stage. And I think it is a culmination of all the different things that Stacey mentioned and Lori. It's, the toxicities that we face, the diet, the gut being imbalanced, stress, and all of those things. So the goal for us is to, again, get to the root cause of all that and help offer holistic modalities in addition to, if they want to, chemo or just by itself. But we know powerfully that the plant-based medicine does have the ability to help people get into remission, but you have to be disciplined and very strategic in how you manage that.
Hyperbaric oxygen. The intensity of cancer, have you seen a difference since COVID? Because that spike protein being a systemic infection, kind of damaging multiple organs in a person's body. I noticed that it seems to be more aggressive and, like you said, in a younger patient since COVID.
Yeah, definitely. So I think definitely COVID has increased the prevalence and the intensity of the cancer. I think just from my experience being in the lab, I was in a gene therapy lab as a fellow when I was training. And it's not only the spike protein, but the virus itself can actually insert in the DNA and turn on oncogenes. So I think we're seeing like a genetic transformation. Of course, we know the mRNA technology that they use with some of the vaccines is completely new, not tested in humans, right?
Advent of COVID, stressors too. Stress has really increased. And I think that, a lot of people were not like working out or doing their normal things, the lack of social interaction. I think there's like a whole host of things that are contributing negatively to the state of people's health and well-being currently, and we're working towards it. My youngest child, when we started lockdown, was in the 5th grade, so they were locked down during middle school, for the first year and a half of middle school, being that I'm in the Detroit area and we had a lot of illness in the area, so they didn't go back to the classroom for like 18 months. So social interaction, stressors. I think a lot of people that, had maybe good habits, workout habits, and social interaction, and even going to like an office, versus working at home by yourself all the time is, gives you some social interaction. So I think that things are even like what I was able to do at the hospital, like a lot of the work that I do was not necessary, during COVID, because I work more closely with people. And so I'm glad to see that we're moving in the right direction again with people being able to, get back to working out at gyms and parks are open. I mean, parks were closed, everything was closed, in this area. So I know people who live in more rural areas and they had a little bit more options to be outdoors and so on. But other than taking a walk or riding a bike, there was nothing that you could do, physically at a place. And when you live in a climate that's, not warm all the time, that made it a little bit more challenging and a lot of things weren't open. So I think there's a lot of things that contributed. And also a lot of people, I think, just let their eating habits go during COVID. So,
the 2019, 19 pounds, right?
Yeah.
yeah.
That's the average. Yeah.
So Jim,
So,
the question for Jim, given the COVID, so you focus on young men that are around college age, and as Stacy
Right.
mentioned, yes, sir.
No, I focus on young men now. Back then, pre-COVID, I actually had a brick and mortar office. COVID is what took everything online. With my near-death experience earlier this year, I want to focus on the demographic where I have the most fun, and that is men mid to late teens to late 20s.
So how did COVID affect the population that you work with? Because as Stacy mentioned, her child is, she's in high school now, and she was in 5th grade. So if you're working with men that are in their 20s, 25 and younger, they were in high school around during COVID, so they were severely affected, especially in Nevada.
So, and it's funny. Very few clients here in Nevada. Most of my clients are online right now.
Okay.
And one of the things I will say is that a lot of my clients do not understand the simple, basic things around dating. I had one client, and I literally had to date coach him on how not just to go 110 miles overboard because a potential partner of his expressed interest in him, and he didn't know how to handle it because he had done no dating during those COVID times. So it's like they don't know how to simple things like flirting. Like, how do you flirt? Like, flirting is a learned behavior. And if we think about most of y'all here are far younger than I am. But if you think about when you were going to school, as you were developing, flirting it's something you learned in interacting not only with same gender but opposite gender.
I just saw this web of connectiveness about what happened to all of us and our families during COVID. And the term sheeple came up, in certain circles. But it's the same thing as the way people that are not aware that services like ours exist view medicine. It's this one-track, blinders on, non-discerning. We have so much information available at our fingertips. I look at the whole women's health initiative that derailed so many women in my age group, right? And it was misrepresented. And it came to the front of our attention because some brave women doctors that went on podcasts and are on Instagram and said, we're just going to tell the truth. And they stopped working, or they worked less in traditional medicine jobs. And it's like amazing to me. And we need to really encourage, and so much of what I do is really educating people about what their blood tests really mean and what action they have. And I think by and large, if people are more educated, I think they'll show up at the doctor's office being better patients, So it was just, all of a sudden I saw the connection. It was like, oh my God, Americans showed up the way they show up to their doctors, the way they showed up to COVID. And I'll take the shot. And nobody was looking at what might happen.
She talked about how children getting vaccinated in Florida should be up to the parent. Lori talked in her speech today about even when it comes to birth versus C-section versus a vaginal birth, they don't have the microbiome. And when you think about Stacy Theodosopoulos,
I had uterine
uterine
fibroid
fibroids.
tumor.
That's what it was. Uterine fibroid tumors. I apologize. She had uterine fibroid tumors. And with the tumors, the doctor said there's nothing we could do. You have to get surgery. Well, she knew that if she got surgery, there'd be a high chance that she wouldn't have children.
Well, the surgery they recommended was a hysterectomy. So absolutely wouldn't have had children if I had a hysterectomy in my early 20s.
Exactly. And
yeah,
she did energy healing, which they, our last speaker with Jezy, we were talking about energy healing and how the people try to say that energy healing is woo woo. Well, it's proof that she has 2 kids now. So it worked.
Yeah.
So it just goes to show you, as Lori put, that it's the lack of education. And that's why I'm on all of you about, you got to get studies. You got to put studies. You got to put studies. You got to put studies. Because the fact that we're using Noster, even if not Dr. Taylor puts out a study about cancer, they can't take it down because it's going to be on Noster. But essentially, it's become censorship resistant, right? And one person that's not even on here, when you talk about marketing, is Dr. Barnes. We didn't do really any marketing at all for Dr. Barnes. The only thing we did was post her studies, and she has more clients. That's really what I stress about studies. Whether it's Stacy doing a study about how Ayurveda can help with emotional well-being or burnout, whether it's Dr. Taylor and Lori working on a dual study about how you can help with cancer utilizing functional nutrition, whether it's Lynn working on how hypnosis and subconscious reprogramming can help you get over toxic relationships and narcissism, whether it's Jim and how his methodology can help you with overcoming trauma. Because again, not to get into politics, but another thing that Jim said that really blew my mind was the fact that a kid who's in college, he was there when Charlie Kirk was assassinated. And it didn't take him that long. It took Jim 18 years to get healed. It didn't take this kid very long to become healed from the trauma because of the work that Jim does. Yes, sir, Jim.
Well, and I got to tell you, a former client, his brother and brother-in-law were all at the assassination. The brother-in-law was 20 feet. He was number 3 in line to ask a question. And the father called me that afternoon and said, he paid me. He said, I want to have a session. I had a Zoom session with 7 people. So I had a Zoom session with the father, the mother, the 2 brothers, their sister, the one sister's husband, and one other person associated with the family. And in 3 hours, we processed all of their trauma. Now, the easiest one to process was my former client, because he knew how we create this experience called life, so he could take what he saw, and to my knowledge, all 7 of them are still doing well. And I know 6 of the 7 are, because I have to be honest with you, the brother-in-law, the husband of one of the sisters, in 40 minutes, I cracked him open, and his wife told me he never expressed emotion. He had all this stuff, and I cracked him open, and I attempted to work with him. He owns his own business, and he's very successful, but he came back and said, I'm fine. And the Charlie Kirk thing didn't, but what if we as a society took a look at like serious trauma things like that, and we were able to process them quickly instead of having them come up years later?
And Dr. Vollner, I wrote it down, addressing the vagus nerve using naturopathy and chiropractic for gut health. So all of you can do studies that maybe not tomorrow, but in the future, JAMA and some of these big publishing institutions will see we can't stop holistic medicine. There's too much data now. There's too much information out there. So whoever wants to jump in.
I'm a little out of the water because I'm not a medical doctor, but I will tell you that I had cancer 11 years ago. They removed one of my organs, and in all my looking around, I have on St. Patty's Day, it'll be 12 years since I had my organ removed, but I have been doing nutritional mushrooms, and I've been doing a hot smoothie blend in the morning to keep my immune system strong, because I don't ever want to go through cancer again. And the funny thing is earlier this year, I had a near-death experience. I spent 6 days in the ICU, and they wouldn't let me take any of my my supplements. They are like, absolutely not. And I got through all of the pharmaceuticals, which I will say, when I got home and they said I couldn't take anything, I was just taking 4 pharmaceuticals. I had to call a friend and have him come take my guns away because all those pharmaceuticals put me in such a mentally dark space that I had to call somebody and say, you got to come get these guns, because when it's 2, 3, 4 in the morning, you can't sleep. And I had 5 broken ribs and a braided lung, a broken spine, and they had to end up doing emergency surgery to put a stent in my femoral artery because it was ready to burst. And I had just these chemicals that I had to take, and my mind went as dark as it's ever gone in my life. And the moment I was done with them, I didn't get any refills. I got back on all of my supplements, and whatever the date to June 26th to now, I'm feeling far better. But so it's like, I mean, like even little things like nutrition, like they're like, no, you can't take nutritional mushrooms. And I've created my own blend that I feel at a spiritual level works for me.
100%. And Dr. Taylor or Lori, you want to jump in, but just one thing to add, because she's not here. Something that Dr. Barnes said that I think needs to be stated is, yes, we talk about supplements, and supplements are good, right? Like, Lori is a proponent of supplements. Jezy was speaking earlier about how supplements have helped her with certain things. But the thing that we tend to sleep on, especially in the Western world, and Stacy knows in the Eastern world, they do this, is herbal medicine, plant medicine. You look at PTSD, and Jim said something really valuable about PTSD, which is that it isn't just
the integration. It's like,
yeah.
When I do plant medicine healing for people with severe trauma, I'm going to say about 10% of the healing comes from taking psychedelic mushrooms. The 80 to 90% comes in the integration after, where there's a group of people and we talk about it and everybody's like, oh yeah, oh yeah, oh yeah. And all of a sudden they heal. The incident still happened, but the trauma that's associated with it gets de-escalated down to where they don't have anxiety and PTSD symptoms.
I really appreciate what you're saying, Jim. When COVID happened, I remember I started a group online, and we were going to lose the COVID-19 pounds with fasting.
Yeah, I remember that.
With Prolon. And honestly, blew me away. But 3 months later, and I was writing a PowerPoint every week and teaching them things, and I didn't know what I was doing. I was new to Zoom. I really was new to Zoom. So at any rate, after 3 months, I said to this group of 12 people, 11 women, 1 guy, previous patients. And I said, do you want to go on? What do you want to do? I don't know what else to talk to you about. And every single one of them said, don't stop. And that is the power of community that, I think groups are probably the most powerful way to treat a homogeneous diagnostic kind of mix or age group or whatever it is. You know what I mean? I think it's so powerful. And that group stayed together for 4.5 years. I mean, blow me away.
And with that, and she hasn't spoken, but something that Lynn said at the end of her presentation today, I asked her, I said, who can you connect with? She said, other hypnotists, other trauma practitioners, and people in the mental health space. Everything that we're doing, the only reason why we're doing this stuff is because, unfortunately, unlike allopathic medicine, we have to do these things because this is how we get the word out there. Because allopathic medicine, and again, they might try to shadow ban us, but we're unstoppable because we're only going to get more providers. We're only going to get bigger. So because of the community effect, even the powers that be can't stop this platform. But the whole point I'm trying to make is that we do this so that you guys can heal the world.
Can I speak?
Yes, ma'am.
Yeah, my sister tried the mushrooms about a year ago. She sits all day, and her one side of her face went, the nerves, pain, and like was frozen. And it was very, very painful. It would come and go, but it was very painful. So she started trying the mushrooms. It was an experience. She said when she started it, everything, all the trauma came out in one session. All this trauma was coming out of her, and experiences that she remembers from like 30, 40 years ago were coming out again. But she said, the trauma was released, and her face got better, the nerves. But I truly believe that stress does so much to the body and the mind. And we, as we know, we're all very stressed today in these days. And I think stress is the number one thing that, it's like a branch. We have stress, and then we have everything branching out from stress. Yeah.
Jim?
Real quick to that. I'll be quick. When people come to me and say, I just want to do a mushroom ceremony because I want to get rid of this, my first answer is no. You need to work with somebody, because I equate it to opening Pandora's box.
Right.
And if somebody takes too much or the wrong type of mushroom,
you have to be guided.
Yeah, because if you're guided, then you know what happens when all these sprites come out. And as opposed to going from these like learning lessons, because some people can literally experience more severe trauma because everything came up at once and they weren't able to process it. So now they've taken 10 steps backwards.
Yeah, you have to have the company of a professional or someone there, because it can be quite traumatic, right?
Yes.
Yeah.
Yeah, I was just going to mention about stress. So it's not just stress, because we all face stress, right? Every single person on the earth, actually, since we come from the womb, we all experience stress, but it's our response to stress. So I like the fact, that Jim guides people and Lynn helps people to heal from the stress. And Dr. Bollner mentioned, I think, something about the parasympathetic and putting people in that state. So important. I think Stacy mentioned that as well. So I think, part of holistic healing definitely needs to be kind of retraining the mind and teaching people how to breathe, how to relax, how to put themselves in like a relaxed state, because again, we're all going to face stress, but it's a matter of how we respond to it. And our minds are so powerful in that if we can rechannel the energy and get in that relaxed state, that literally sends signals to our bodies to not get inflamed. And that definitely can, prevent some of the chronic diseases, including cancer.
I still do weekly sessions with a CBT therapist for trauma, and you're right. Like, you have to get educated in why you are feeling this way, and we all have ways of dealing with it, and sometimes the ways we have of dealing with it aren't really serving our own good. So I work with a CBT trainer, and she helps me to get knowledge on what's a better way of doing this, and through having narcissistic abuse, and I tend to sometimes go to the negative side of things, and my mother was a worrier, and I've worked on that through the years, but it's just being educated on ways to deal with a moment that comes up. Say trauma starts coming up in you, and how to, positive thoughts, different ways. I have a whole list of things to do, but we catastrophize, we do all these things, and there's just, you're right. It's how we deal with it. It's how we react to it, and
Jim?
I just want to say, there was a part of my career where I led breath work in addiction recovery centers for people that were just less than 30 days into sobriety. And the breath work was so intense, yet I saw so many miracles. Breath work, if done right with the right intention, the right setting, is another way. Just to me, it is equally as potent as mushrooms if you have the right person guiding. And then again, we're going to go back into integration. If after the breath work, if you can integrate what you learned, it becomes one of the most powerful. It becomes another way to heal that like people in addiction recovery can do because they're not taking any drugs of choice. It's just air, spirit, and you.
You know, to your point, Jim, and then Dr. Volner, you know, about the integration. So earlier this year, we shot a documentary that some of you may or may not have seen about Kambo and Bufa for a veteran that was in the Israeli army. And really what I noticed is that it wasn't just about him doing the medicine. It was about the integration. It was about the shaman. It was about how she, Dr. Shelley Prasad, how she walked him through she's a former chiropractor as well. So she integrated chiropractic as well in him doing the medicine. She integrated breath work as well. She integrated all of these different practices, fascia work, into him doing the medicine, so that it wasn't just, do the medicine and you're on your own. And what I found, and they spoke on this, is that in a lot of instances, people go to Peru, they go to Mexico, they go to these places where you just get a bucket and you're told, hey, do ayahuasca. And you don't have any of the therapeutic element of healing it. They just expect you to just do the medicine. And that's why a lot of people will do, ayahuasca 20 times or these psychedelic medicines over and over again, because they're not doing the therapeutic side of the medicine. Dr. V, and then Jim, if you want to add to that.
I had a call yesterday from someone who is just flipping out at work. And the first thing I recommended was just stop all screen time, because television, computers, tablets, and the speed at which people are integrating that information, or lack of, because they're just scrolling and the pixel amount is stressful to the brain. I just stop all screen time, get a coloring book and some crayons, and alleviate stress by doing something different that is still, maybe you're thinking is mindless to distract you from your stress, but it's therapeutic. Coloring in a coloring book, just something that's simple. I recommended a supplement as well, since it was a little too over the top strong. But just those two items alone, and prayer, communicating with a person and with God. And research has shown over and over again, less complications, faster healing time, even from surgeries, for people who are surrounded with people and who pray. No real explanation as to how the power of God gets to you, but it does. And there's healing in that. So even in natural medicine, it does not have to be a pill. We don't operate like, here's a symptom, here's a pill to fix it. Many people do in functional medicine and natural medicine, because they're still operating with a medical mindset. Here's a symptom, here's a pill for it. And it takes much more than that to be a whole person, to heal back to stimulating vagus nerve again, because there's so much happiness and healing in that. And there's all kinds of research on happiness now, how to stimulate the right side of your brain. I do chores with my husband, but I do it to music, because those are his chores, not my chores. And he's stepping into dementia, which can be quite challenging and stressful all on its own. And so when we are putting on music, if he's stressed, I put on his music. And when I'm doing stuff I don't really care to do, I put on my music. because we each have our favorite songs, favorite patterns. But it's always something that's a more positive, stimulating, because music, even in the flat tones, is depression developing. Those who are in sharps or in C, in certain rhythms, have been shown to be very happiness stimulating. So there is more to natural medicine and creating a holistic life thought process than disease pill.
So as we reach our last 5 minutes, I want to give each of you the chance to speak about what you're working on and how you address your patients. So we'll start with Stacy.
So again, I've been working in Ayurvedic medicine and energy healing for 30 years now. So I'm continuing to work in the oldest, most complete holistic medical system in the world and applying it to the world that we currently live in, So I agree. Somebody had mentioned, I think it was Lori, about community. And I really feel like community is an antidote to a lot of these stressors that people have. So I actually, one of my healing programs is a year-long journey where we do that in community. And then people are within the community are supporting each other, and they feel less alone with the problems that they are experiencing. Just knowing that somebody else is had a shared experience is helpful. So I'll keep it there so everybody else has their chance.
Dr. Taylor?
Yeah, so I am working on educating patients with chronic diseases, complex conditions like cancer, that there are other modalities other than pharmaceuticals that can help heal their body. So hyperbaric oxygen therapy, red light therapy, IV vitamin therapy, working with a nutritionist, doing breath work, and all of those holistic mechanisms, and also letting them know that it's important, as someone just mentioned, about community and surrounding yourself with positive support. Definitely look forward to working with Lori, Dr. Volner, and Stacy and creating data. And maybe we can create some data points that we collect. But definitely the research is there, is scientifically based. We just have to educate more people, collect the data, and publish.
Lynn?
Yes, I work with victims of narcissistic abuse, and of course, with narcissistic abuse comes an enormous amount of stress and depression, anxiety, and a lot of these people are suffering. So through a lot of what we talked about here today, like I meditate, but I prefer the self-hypnosis, going to the subconscious mind and improving what we're thinking. Of course, nutrition helps, and keeping a positive mindset, and narcissistic abuse can deeply affect our whole being and our world. So my passion is helping people get through this and heal, because a lot of lives are wasted living in abuse, and a lot of these people have gifts and talents that are not being expressed and are not being shown. So that's my passion. I just want to help people heal from it and live full lives and be happy.
Jim?
So first off, it's such an honor to be with all of you. You are all such an incredible group of people. At the core of what I do is trauma. And my goal is working with men, young men and older men, so that not only can they become better humans, but they create amazing lives that ripples to everyone around them.
Lori?
Thank you for bringing together such a highly experienced and educated group, because it's really an honor to know that we're speaking as kindred professionals with our own unique kind of talents. And you just gave me like great people to think, oh, I have referrals here. These are people I would trust. So what I'm up to is aging gracefully with power, with vitality, with cognitive awareness, and taking along all the people that have followed me over the years into that journey with me, because I just don't think there's wiggle room as much as the older that you get. So we have to give up all the processed food.
I am focused mostly on reversing diabetes because the 100,000 miles of blood vessels in your body are burned and damaged, and thus all organs are damaged. And it gives my knowledge base, which is quite wide, a direction to go in to help people with every aspect of the damage of diabetes, including dementia, eye problems, digestive problems, and so on. It is a lot involved in diabetic challenges. And to make people aware that they have tools available to them that were not available to the general populace without a prescription. You can use your HSA on, that you can have knowledge that you didn't have before, pretty pain-free too, to get where you want to go. Very simply, because I like having tools and tests and the new CGMs that are available to the general public without a prescription have just, it's amazing how it's helped people just be aware of how everything you do during the day, whether it's food or stress or work too long or whatever, it's affecting blood sugar, chronic low level inflammation. That's affecting every bit of that 100,000 miles of blood vessels. And for every pound you are heavier, every 5 pounds, you have 20 more miles of blood vessels to deal with. So there's a lot to be concerned with in how we're getting oxygen, longevity, clarity, and just full function, vitality back into your life. But I'm connecting with National Institutes of Health and attempting to get funding for expanding how CGMs and prediabetes come together and can lower that risk for diabetes and lower a lot of metabolic syndrome problems. That we're trying to make that attempt so I can stay focused on one thing and not 5 different businesses at once. How about that? But that'll be very fun.
Thanks for joining us for our first DecentMed Summit. You can catch the roundtable at decentmed.org/summit, and the full recording will be available on Patreon.